So let's talk about that story and more with Dr. Suman Radhakrishna, the Director of Infectious Disease with Dignity Health in California Hospital. Doctor, good to see you. So does that make sense to keep gyms, hair salons, nail salons, churches, keep them all open while at the same time shutting down restaurants indoors?
Well, first of all, thank you for having me. And, ideally, you would want to restrict everything, but then you have to pick one over the other. And if it's just one-on-one, such as in a hair salon or a nail salon, and it is restricted in a church where people are socially distanced and masked appropriately, it should be safe. But again, if you are susceptible, if you are at risk of getting severe COVID, those are the people who should not be going to any of these places. All the others who are at low risk, if they wear a mask and follow the proper procedures, and the churches and the gyms and hair salons and nail salons follow proper procedures, we should be okay. But only time will tell.
And let's talk for a moment about masks, because you shared with us this graphic that we want to put up on the screen that shows how masks worked. At the top of this, you have somebody who's infected, asymptomatic, means they don't realize they're infected. They cough. You look, all that stuff goes towards somebody with a mask.
Or even just talking.
Someone not
just talking will do that too.
Yeah, and then on the bottom of the screen, if everybody is wearing masks, talk to us. You see these cases firsthand. You've seen this in terms of hospitalizations. Talk to us about the importance of masks and what you're seeing yourself.
So what does a mask do? It protects the person in front of you. It reduces your secretions. Now, if the person in front of you is also wearing a mask and you are wearing a mask, then the protection is even more. So it goes back and forth. So you protect the person who you're talking to. The person who is standing in front of you and talking back to you is protecting you. So everybody's protected. If you can avoid it, and if you can avoid face-to-face contact, just like, I'm doing remotely with you, then we don't need a mask. I don't need to wear a mask because there's nobody in this room with me. But if we were sitting in the same room and we were closer than 6 feet, a mask is crucial. If you're more than 6 feet, a mask is a double protection. It's helpful.
A lot of bandana news today, Alex. Talk to us about that. No, I'm going to let Alex present this now.
Yeah. So there's some research at Florida Atlantic University tested the effectiveness of face masks. Bandanas, not so effective when compared to a cloth face mask with a pleated cloth mask. That study, Dr. Drew, conducted by the College of Engineering and Computer Science.
Yeah.
What do you see when you see this?
That's a regular mask. That's a pleated mask. That's double thickness, which again, that's a bandana mask there. You see how it could easily get across to another person. So the bandana is really, if you're wearing a bandana, you got to make sure you're at least 4 feet away from other people or that they're wearing a mask. Again, pleated mask, you're pretty good, even if the other person isn't wearing a mask. But bandana, there is concern about the effectiveness of just a single cloth bandana now.
And then, Doctor, I had a question about face shields. I bought one of these today. It's certainly more comfortable if you're working out at a gym, but is it as effective as wearing a regular mask?
The face shield helps predominantly protect you from getting any secretions in the eye because it covers both in front, like your glasses do, and also on the side, which your glasses don't. In terms of protection from your mouth and oral secretions, perhaps it's equivalent to a bandana. So a face shield plus a mask is usually what is recommended, not just a face shield.
And my wife was pointing out too, hey, this is a way to add help protection against servers. If you're eating, we eat now without anything on, but you had a face shield on, you can get the food to your mouth and also help protect the servers.
Interesting idea.
It is, but try eating with a face shield, you'll realize how tough it is.
Okay, fair enough. I haven't tried yet.
All right, I look forward to hopefully one day, and when this is all done, we can all eat together. Dr. Suman Radhakrishna, great to see you. Thank you for all the hard work that you're doing to help save lives.
Thank you for having me.
All right, up next, Council.